Are you an international doctor who wants to migrate to Australia and work as a GP? If so, you might be wondering how to go about it and what are the tips to make your transition smoother. In this podcast, I will cover some of the essential information you need to know before you pack your bags and head down under. Australia is a popular destination for many overseas trained doctors who are looking for a better quality of life, a diverse and friendly culture, a robust economy, and a world class healthcare system. Australia has a high demand for skilled medical professionals, especially in rural and remote areas where there are shortages of local doctors. However, moving to Australia as a doctor is not as simple as buying a plane ticket and applying for a job. There are several steps and requirements you need to fulfill before you can practice medicine in Australia. These include number 1, obtaining a successful skill assessment from the relevant authority. Number 2, getting registered with the Australian Health Practitioner Regulation Agency and the Medical Board of Australia. Number 3, applying for visa that allows you to work as a doctor in Australia. Number 4, finding a suitable role that matches your qualifications and experience. Number 5, moving to Australia and settling in your new environment. Now let's look at each of these steps in more details. Step number 1, skill assessment. The first step to migrate to Australia as an international doctor is to get your skill assessed by the relevant authority. This will determine if your qualifications and experience are comparable to those of Australian trained doctors. There are two main authorities that assess the skills of international doctors. Number 1, the Australian Medical Council (AMC) and the Royal Australian College of General Practitioner (RACGP). The AMC assesses doctors who have completed their primary medical degree in a country other than Australia, New Zealand, UK, Ireland, Canada, or USA. The RACGP assesses doctors who have completed their specialist training in general practice in a country other than Australia or New Zealand. AMC conducts two types of assessments, the standard pathway and the competent authority pathway. The standard pathway involves passing two exams, the AMC multiple choice question (MCQ) exam and the AMC clinical exam. These exams test your knowledge and skills in basic medical sciences, clinical medicine, and professional practice. The competent authority pathway is for doctors who have completed their primary medical degree and internship in one of the following countries: UK, Ireland, Canada, USA, Singapore, or Hong Kong. These doctors do not need to sit the AMC exams, but they still need to apply for an AMC certificate. The RACGP conducts three types of assessments. Number 1, the specialist recognition pathway. Number 2, the general practice experience pathway. And number 3, the practice eligible pathway. The specialist recognition pathway is for doctors who have obtained their specialist qualification in general practice from one of the following countries: UK, Ireland, Canada, USA, South Africa, or Singapore. These doctors do not need to sit any exams, but they still need to apply for RACGP fellowship. The general practice experience pathway is for doctors who have at least 4 years of full-time general practice experience in any country. These doctors need to sit two types of exams. Number 1, the applied knowledge test (AKT) and the key feature problems (KFP). These exams test your knowledge and skills in general practice. The practice eligible pathway is for doctors who have at least 1 year of full-time general practice experience in any country. These doctors need to sit three types of exam. Number 1, the AKT. Number 2, the KFP and the Objective Structured Clinical Exam (OSCE). These exams test your knowledge, skills, and communication in general practice. If you are an international doctor who wants to migrate to Australia, you need to know about the different pathways and requirements for registration and visa. Here is a brief overview of the main steps and costs involved in each pathway. Number 1, competent authority pathway. This pathway is for non-specialists or specialists who have passed recognized examination or completed training through a board approved competent authority such as UK, Canada, Ireland, Singapore or USA. You need to apply for provisional registration with the Medical Board of Australia and complete 12 months of supervised practice in Australia. The fee for provisional registration and for general registration is $787 as of 2022. You also need to apply for a visa that allows you to work in Australia, such as Skilled Independent Visa subclass 189, Skilled Nominated Visa subclass 190, or the Temporary Skill Shortage Visa subclass 482. The visa fees vary depending on the type and duration of the visa, but they range from $4,045 to $8,405 as of 2022. You can find more information about this pathway on the board's website and the Department of Home Affairs website. Next is standard pathway. This pathway is for non-specialists who are not eligible for competent authority pathway or the specialist pathway. You need to pass the Australian Medical Council exam, which consists of a multiple choice questions and clinical exam. The fee for this MCQ exam is $2,720 and the fee for clinical exam is $3,795 as of 2022. You also need to complete a period of supervised practice in Australia, which can vary from 12 to 48 months depending on your level of experience and performance. You need to apply for provisional registration with the board and then for general registration once you have completed the supervised practice. The fee for the registration are the same as for the competent authority pathway, that is $787 each. You also need to apply for a visa that allows you to work in Australia, such as the ones mentioned before. You can find more information about this pathway on the AMC's website and the board's website. Next is specialist pathway. This pathway is for specialists or the specialists in training who have completed their training and qualifications in their country of origin and want to work as specialists in Australia. You need to apply for assessment by the relevant specialist medical college, which will determine your comparability to Australian standards and your eligibility for specialist recognition or area of need positions. The fees for assessment vary depending on the college and the specialty, but they range from $1,000 to $10,000 as of 2022. You also need to apply for specialist registration with the board, which costs $1,137 as of 2022. You also need to apply for a visa that allows you to work as a specialist in Australia, such as the Employer Nomination Scheme Visa, subclass 186, the Regional Sponsored Migration Scheme Visa, subclass 187, or the Temporary Skill Shortage Visa, subclass 482. The visa fees vary depending on the type and the duration of the visa, but they range from $4,045 to $8,405 as of 2022. You can find more information about this pathway on the board's website or the relevant college's website. Now, the second step to migrate to Australia as an international doctor is to get registered with AHPRA and MBA. These are the bodies that regulate all health practitioners in Australia and ensure that they meet the standards of safety and quality. To get registered with these bodies, you need to meet several requirements, such as having a valid skill assessment from AMC or RACGP, having an offer of employment from an approved employer, having a valid visa that allows you to work as a doctor in Australia, having sufficient English language proficiency, having no criminal history or professional misconduct, having adequate professional indemnity insurance. Depending on your skill assessment and level of experience, you may be granted one of the three types of registration. Number one, general registration. This allows you to practice independently as a GP in any setting in Australia. Number two, specialist registration. This allows you to practice independently as a GP with recognized specialist qualification in Australia. Number three, provisional registration. This allows you to practice under supervision as a GP in an approved position in Australia. The third step to migrate to Australia as an international doctor is to apply for a visa that allows you to work as a doctor in Australia. There are various visa options for international doctors depending on your skill assessment, level of experience, and employer sponsorship. Some of the most common visa options for international doctors are Subclass 189, Skilled Independent Visa. This is a point-based visa that allows you to live and work permanently in Australia without employer sponsorship. You need to have a positive skill assessment from AMC or RACGP, meet the minimum point score of 65, and be invited by the Department of Home Affairs to apply for this visa. Subclass 190, Skill Nominated Visa. This is a point-based visa that allows you to live and work permanently in Australia with state or territory nomination. You need to have a positive skill assessment from AMC or RACGP, meet the minimum point score of 65, and be nominated by a state or territory government to apply for this visa. Subclass 491, Skilled Work Regional Provisional Visa. This is a point-based visa that allows you to live and work temporarily in regional area of Australia with state or territory nomination or family sponsorship. You need to have a positive skill assessment from AMC or RACGP, meet the minimum point score of 65, and be nominated by a state or territory government or sponsored by an eligible relative to apply for this visa. Subclass 186, Employer Nomination Scheme Visa. This is a permanent visa that allows you to live and work in Australia with employer sponsorship. You need to have a positive skill assessment from the authorities, have at least 3 years of relevant work experience, and be nominated by an approved employer to apply for this visa. Subclass 482, Temporary Skill Shortage Visa. This is a temporary visa that allows you to live and work in Australia with employer sponsorship. You need to have a positive skill assessment from the authorities, have at least 2 years of relevant work experience, and be nominated by an approved employer to apply for this visa. The fourth step is to find a suitable role that matches your qualification and experience. There are many opportunities for international doctors to work as GPs in Australia, especially in rural and remote areas where there are high needs for medical services. To find a role as a GP in Australia, you can use various resources such as online job boards and websites such as Seek, Indeed, Health Workforce Queensland, Rural Workforce Agency Victoria, etc. Recruitment agencies and consultants such as MedRecruit, Wavelength International, MedWorld, etc. Professional networks and associations such as AMA, RACGP, ACRRM, etc. Word of mouth and referrals from colleagues and friends. When looking for a role as a GP in Australia, you should consider several factors such as location and setting of practice, scope and variety of services offered, patient demographics and health needs, remuneration and benefits package, support and supervision available, professional development opportunities, cultural fit, and work environment. The final step to migrate to Australia as an international doctor is to move to Australia and settle in your new environment. This can be an exciting but also challenging process as you will need to adjust to a new culture, lifestyle, health system, and workplace. To make your transition easier, you should prepare yourself well before you move and seek support after you arrive. Some of the important things you can do are research about the place where you will live and work, arrange your accommodation, transportation, banking, insurance, etc. Pack your essential documents, belongings, and medications. Apply for your Medicare card, tax file number, driver's license, etc. Register with your local Medicare local or primary health network. Attend orientation and induction programs offered by your employer or agency. Seek mentoring and feedback from your supervisor or colleagues. Join local community groups or activities that interest you. Maintain contact with your family and friends back home. Moving to Australia as an international doctor can be a rewarding and fulfilling experience. By following these tips and steps, you can make your migration journey smoother and more successful. We hope that this podcast has been helpful and informative for you. If you have any questions or comments, please feel free to share them with us. Visa to Land is a registered and approved consultancy by AHPRA, Department of Home Affairs, Australia. If you are interested in migration to Australia as a doctor, registered nurse or aged care worker, then drop us your detailed CV with DOB for review by our medical affairs consultant. Thank you.